All right, everybody. So we are going to look at multiple myeloma, and I had briefly touched on multiple myeloma when I talked about it under, I think it was under leukemia. It was the last slide on that particular PowerPoint. So now we're just going to unpack it a little bit more. So we know that it's a malignant disease of the most mature form of the B lymphocytes. So it's a malignant disease of the most mature form of the B lymphocytes. We also know from our previous slides that we have malignant cells that produce an increased amount of a specific immunoglobulin that is basically non-functional, right? And we also mentioned already that that plasma substance that's present breaks the bone down. So here for multiple myeloma, we are especially concerned about the bone and where, so pain is going to be an issue for these patients. So things like movement, safety, fractures, those types of things are going to be things that you'll be monitoring very carefully. So, blood disorder related to lymphoma and leukemia usually arises in the bone marrow. So, that word myeloma already gives you a hint that it's the bone marrow that's involved. There is no cure for multiple myeloma, but treatments are available that slow its progression. So, it is important to know which cancers are treatable, like which cancers can we get to be in remission versus the ones that maybe all we can do is just diminish the symptoms. So here you're told right off the bat that there is no cure. So that's something that I would want you to be aware of, only because it's important when it comes to teaching a patient about this condition, because if they have this particular condition, they're going to Google it, they're going to know that there's no cure. So then issues of depression, anxiety, this being a death sentence are even that much more for this patient. So what you're going to do is focus on the fact that, okay, but we do have treatments that can slow its progression, and you don't necessarily have to have the worst form of this particular condition. So your plasma cells basically multiply abnormally, because so keyword is always multiplication, a lot of proliferation within the bone marrow, and then you get weakening of the bone that happens. And we've already described the immunoglobulin feature that's responsible for that. So, so once again, it's cancer, it's proliferation, but for this one, it is specific to the bones, and the bones become very weak. So your tumor cells invade the bone marrow and they destroy the bone. It's twice as common in men as it is in women. It usually develops after 40 years of age, twice as common in African Americans, develops slowly and insidiously. And our key feature, once again, is that skeletal pain. And then also the patient can have things like diffuse osteoporosis. So the way that the patient may describe the pain is that they get a lot of pain in their back, in their ribs, and I think your book makes a point of saying that 2/3 of patients say that their pain really gets worse with movement and then it gets better with rest. So that makes sense. In terms of your clinical presentation, so we have quite a few features here, and none of them are that unique. So let's see. So we have things like excruciating pain. We have the fact that they're at risk for dehydration. Uh, with the bony degeneration that's going on, they get a loss of calcium from the bones, and the calcium leaves the bones and then it goes into the serum. So you have hypercalcemia. So calcium leaves the bones and it goes into your serum, and you have hypercalcemia. So essentially now you're dealing with hypercalcemia. So you have a slide from before that deals with hypercalcemia. So therefore, what does the treatment look like if somebody has hypercalcemia, and what are some of the manifestations that you may see in this patient? So you've been given some of them here. So things like confusion, excessive thirst, constipation, all of that may be found in your patient with hypercalcemia. Patient may have high protein levels, and if they have high protein levels, then you're worried about renal failure. So remember, once again, it's a cancer. So there's a lot of cells that are proliferating. At the same time, some of these blood cells are basically dying off. And anytime blood cells are dying off, they're releasing things like protein. And if you're getting too much protein, there's a possibility for all of that to become like sludge and basically go to, in places where it shouldn't be going. It becomes like a weird material basically that shouldn't be in your body, and then it's all sludgy, it's funky, going to your kidneys, and it's clogging your organs, and that's not good. So uh, so we're worried about renal failure. So we're going to be monitoring this patient very closely for this as well. And so some of the other manifestations that are pretty similar for cancer, so weakness and fatigue, and that is directly related to anemia. And we've already discussed how somebody that has cancer can end up being anemic. So same information once again. So high blood calcium levels, so hypercalcemia, they have anemia, low red blood cell count, they may have elevated creatinine, and that's going to definitely show that they have an impaired kidney function. So with all of that protein that's being released, if all of that stuff goes into your kidneys now, then the kidneys will have damage. And remember, your creatinine is the measure that specifically lets you know that the kidneys have been damaged. So for sure, if you're seeing elevations in your creatinine, then you know that there's some kidney impairment going on. And the other unique feature for multiple myeloma is that they have what is known as a globulin gap. And what you're going to find is you're going to find high protein levels in the blood combined with a low albumin level. So ordinarily, albumin is usually in the majority in the total serum protein. So we do want some protein to be in the serum because it has that oncotic pressure, right? So remember when we talked about cirrhosis, we talked about when we talked about cirrhosis, we we're talking about esophageal varices and how everything starts backing up, and then protein starts leaking. Wherever protein is going, it has a pull with it, so it starts pulling fluid, and then you end up with things like ascites, third spacing, all that weird funky things. So for multiple myeloma, they're expecting a certain number of albumin to be in the serum, and it's in the larger component in terms of the amount of protein. So albumin tends to be on the higher end. But here in this particular condition, they have what is known as a globulin gap. So they have high protein levels, but then they have low albumin levels. With that as well, they get a protein in the urine. So to describe the globulin gap, you may see them describing it as the difference between the total serum protein and albumin. And that's not something that you necessarily need to memorize or how they calculate it, but know that this is a feature that happens in multiple myeloma. So different diagnoses or testing that they do to basically come up with this globulin gap, or to help them figure out that the patient has multiple myeloma, all of these different tests here. I'm not expecting you to memorize things like serum protein electrophoresis or immunoelectrophoresis or urine protein electrophoresis and urinary immunoelectrophoresis, but just know that they belong under multiple myeloma. And then all the other tests are pretty, I think, well, you're familiar with them. Like, so bone marrow biopsy makes sense, right? Because now the bone marrow is involved. Um, and it's going to show you an abnormally high number of plasma cells in the bone marrow. That makes sense. Plain X-ray films of the body's large bones, because now we're worried about the bone, right? We're worried about bone mineral density even. All of that stuff now becomes an issue, so it makes sense to be doing X-rays. So other testing they're doing is CAT scans, MRIs, or PET scans, all of that just to see how much of the bone has basically been involved um, or hurt by multiple myeloma. So, and then we're looking at our nursing management. So, some of the components have to do specifically with cancer treatment. Some of the components have to do with the fact that the patient has hypercalcemia. And some of the components of management have to do with the fact that the patient is at risk for fractures, right? So, you basically have to have a very holistic approach and you're going to treat that patient that way. So, adequate hydration is a priority, right? Because it's hypercalcemia. Care of patient during chemotherapy. So, we've briefly talked about chemotherapy in the previous slides, and we'll talk more about it in the cancer PowerPoint. Observation for renal failure, we've explained how that could be an issue, and we've discussed renal failure already, so you already know how to monitor for that. Um, Manual handling, risk, or just being very careful when you're handling the patient because they may have pathological fractures. We've done, things like osteoporosis, and we've talked about fractures, so you're familiar with what that particular nursing management might look like. Pain management, huge, okay? And you're familiar with some of the different modalities that may be used for somebody being in pain. So prompt treatment for infection, of course, this is cancer, right? So same exact thing. They're getting chemo potentially, so they become immunocompromised, all those different types of things. You worry about that as well. And psychosocial support is huge here, obviously, because there is no cure. All right. So this particular slide just had extra information on multiple myeloma.